they are not poor enough to qualify for Medicaid, but they don't make enough money to buy insurance. Okay. So we have now added 87% to the money that the state of Ohio gets. Right now, there are 230,000 children in the state of Ohio on SCHIP. We have increased that by 87%. Dr. Martin Luther King Jr. said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. He said that Northeast Ohio has some of the best healthcare facilities in the world. But there are 86,000 uninsured people in the 11th District who cannot access them on a regular basis. And for all of you who wonder why we are going to insure people who don't have insurance or people you think are lazy or whatever your excuse is, understand we pay for their insurance now. Pays a little extra so we can subsidize those who don't have insurance. We already pay a subsidy. If we put those 47 million people on health care insurance, your rates are going to come down because you will no longer be subsidizing other people. We asked about it, I'm all off my speech, so I'm just going to talk. We asked about the cost of health care, and everyone wants to know how we're going to pay for it. Let me say to you two things before I get to that answer. First, that in the state of Ohio alone, between 2000 and 2007, health insurance premiums went up by 76%. 7 years, 76%. This nation spends 17% of our GDP on health care. 17% of every dollar spent in this country is spent on health care. 14,000 people lose health care insurance every day. This country spends more on health care than any industrialized country in the world. And we are 37th when it comes to being healthy. So now, I understand there's a reason to worry about how we pay for it, but the cost of doing nothing is a lot more expensive. Henry Ford said that change is difficult, but he also said, don't find fault, find a remedy. Yeah. And we're finding a remedy. I know that the health care bill is not complete yet, but I would say to you that there are certain things that must be a part of the legislation for me to support it. One is it does have to be deficit neutral, which is what the president calls saying that we are going to pay for it. Right now we have about half of what it's going to cost, and we're still working on it. We're going to have to find a way to pay for it. People say, oh, they think of the public option. It's public, but it's not free. You have to pay premiums just like you would pay for any other insurance company. So unless you have absolutely nothing, if you have any income at all, you will pay for health insurance even under the public option. So we will be receiving premiums as well. It's just not something that we're giving to people. People say they don't want the government running health care. Well, seniors, the government runs health care now. I want to say to you that this legislation is going to have to say to seniors that we are not going to diminish anything you've already received, that we're going to have to make it better because we're going to first start to close up that donut hole. We're going to reduce the cost of prescription drugs. And I want you to be clear on the fact that you will not lose your right to choose where you want to be insured. If you are blessed and fortunate enough to have a job, and you want to keep the insurance you have on your job, you can keep it. We're not going to make you change. We really don't even want you to change. Because that would make the public policy plan very, very big. And right now, we need to find out how this is going to really work. So we want you to stay where you are. Now, if for some reason you don't like it and you really do want to change, then that option is available to you. Let me say what is important about this. There will never be a time when you are denied coverage because you have asthma or high blood pressure or diabetes. If you get sick and stay sick for a long time, you cannot be dropped by your insurance company. 58% of the people in this country have a chronic illness. Asthma, high blood pressure, things that we don't think about as chronic illnesses, but they are. These are people who have been denied and denied and denied. When you think of 58% of the population could be dropped from insurance at any point, or may not even be able to get insurance even if they have a job. There was a young woman in this district. We did a teletown hall meeting, I guess about a month ago. She said that her child was born with a heart defect, had a number of surgeries. Baby still is going to have problems throughout her life. She's still a toddler. But because the insurance only covered up to so much in surgical care and in medical care, they dropped her. As a toddler. She could not find insurance anywhere because the baby had a pre-existing condition. She finally found an insurance carrier to cover the child. It cost her $38,000 a year. That's what more people go bankrupt in this country because of medical bills than anything else. And we just believe that you shouldn't lose your house because you get sick. The other thing that we have determined is that it is a lot cheaper to take care of you when you are well than it is to take care of you when you are sick. Developed around preventive care. We have these insurance companies that have made a fortune on people like me or you or who pay until we get real sick when we get older. So they've taken all this money, they've made zillions of dollars, and then they spend all of the money that they're going to spend on you when it's time for you to die. As opposed to say, we want to keep you well. We want to make sure that we diagnose whatever your issue is early on so that we can keep you well. There is no wellness in healthcare today. So we have to ensure that people understand that this is going to be a preventive care. This is going to be something that you can go to your doctor and have any kind of a screening as long as it is preventive and it not cost you anything. That your premiums are capped. Right now, they're looking at something in the ballpark of $5,000, saying that you would never, ever have to pay more than $5,000 out of pocket if you have insurance. But on the other end, we're going to say to the insurance companies, you cannot cap how much you spend on a particular illness. Most policies are set up, especially with mental health care. And do you know that almost 50% of the people who are in prisons today are mentally ill? But most policies will say you can spend 90 days in the hospital in a year, and you can only spend so much money on medication, and you can't ever do it again. That's why we have people come out and we don't treat them, so they go back. What we're going to do is change all of that so that there is no cap on what your illness can cost, so that insurers have to cover it no matter what it takes. So we are really working very, very hard. I'm going to stop because I know there are people who want to ask questions.